The question is, what about minimally invasive approaches to pancreatic surgery? How about use of the robot? Where does that come into play in the care of patients who need surgery for their pancreas? And I think we've made a lot of great strides in using minimally invasive surgery for patients who need pancreatic operations. Probably where it's most effective is in patients who need distal pancreatectomies for tumors they have in the body and tail of their gland. There, I think that the quality of the operation done using a minimally invasive technique, the complication rate is low, and that operation is safe for the vast majority of patients who need a distal pancreatectomy for a tumor. Now, there are centers, and we are one of them, that are using robots and laparoscopes to do Whipple procedures. But I think it's important for people to know that there is still a steep learning curve using the robot to do Whipple procedures. And you really have to have a very experienced team, and you need to make sure and check with the team and see what their outcomes are. There are a lot of people dabbling in doing robotic pancreatic surgery, and the outcomes that are less desirable are not being reported. So this is an area that I think is still under development, and I think it still remains to be seen as to whether using minimally invasive surgery for the Whipple procedure will be advantageous compared to our tried and true open procedure, which now we can do very effectively in patients with low complications.
But even those open surgeries, the best outcomes come about in hospitals and medical centers where surgeons are doing a lot of these operations every year.
Absolutely.
Yeah. So I think that's a very important point, is that patients and referring doctors need to make sure that they do their homework and they have surgeons take care of them that are extremely experienced in all the nuances of pancreatic surgery, and also that the operations are done at a center that should any complications happen, there's advanced teams that can take care of any aspect of a complication that might happen.
Right, which extends to GI and ICU, and it's not just
interventional radiology,
right.
and all those things.
All of those things, yeah. And I think it's okay to ask about experience and numbers. I think patients need to, I think it's okay to ask about complications, and those are good conversations to have.
Yeah.